Imagine having a conversation with someone you love, and halfway through, they suddenly stop. Not because they forgot what they were saying, but because something else has their attention, something you can't see. They might describe a person standing in the room, or animals moving across the floor. To them, it's real. To you, it's not. Now imagine this happening alongside memory problems, movement issues, and sudden changes in awareness. This is Lewy Body Dementia, a condition that is often misunderstood, frequently misdiagnosed, and deeply challenging for both patients and families. In this video, we'll explore what Lewy Body Dementia really is, what's happening inside the brain, how it differs from Alzheimer's and Parkinson's, the warning signs, treatment options, and how to support someone living with one of the most complex neurological conditions. What is Lewy Body Dementia? Let's start with the basics. Lewy Body Dementia, often called LBD, is a type of progressive dementia. That means it gradually worsens over time. But what makes it different is how it combines cognitive, psychiatric, and movement symptoms. LBD is caused by abnormal protein deposits in the brain called Lewy bodies. These are made up of a protein called alpha-synuclein, and when these proteins build up, they interfere with how brain cells function, unlike Alzheimer's, which primarily affects memory early on. Lewy body dementia often affects attention, awareness, and perception first, and that's why it can look very different. What happens inside the brain? Inside the brain, Lewy bodies accumulate in key areas, including regions responsible for thinking and memory, movement, sleep, behavior. These protein deposits disrupt communication between neurons, and over time, they cause those neurons to die. What makes LBD unique is that it overlaps with features of both Alzheimer's disease and Parkinson's disease. That's why diagnosis can be difficult. In fact, many people with LBD are initially misdiagnosed, sometimes as Alzheimer's, sometimes as Parkinson's, and sometimes as a psychiatric condition. Key symptoms. Lewy body dementia has a distinct set of symptoms, and recognizing them early can make a big difference. 1. Fluctuating cognition. One of the hallmark signs is fluctuation. A person may seem alert and aware one moment, and confused or disconnected the next. This can happen within the same day, or even within hours. 2. Visual hallucinations. This is one of the most defining features. People with LBD often see things that aren't there, and these hallucinations are usually clear and detailed. They may see people, animals, or objects, and they often believe what they're seeing is real. 3. Movement symptoms. LBD shares features with Parkinson's disease, including muscle stiffness, slowed movement, tremors, balance problems. These symptoms can increase the risk of falls. 4. Sleep disturbances. Many people with LBD experience REM sleep behavior disorder. This means they physically act out their dreams, talking, shouting, or even moving violently during sleep, sometimes years before other symptoms appear. 5. Sensitivity to medications. This is critical. People with LBD can have severe reactions to certain medications, especially antipsychotics, which can worsen symptoms or even become life-threatening. How it differs from Alzheimer's. At first glance, LBD can look like Alzheimer's, but there are key differences. In Alzheimer's, memory loss is usually the first major symptom. In Lewy body dementia, attention, hallucinations, and fluctuations appear earlier. Movement symptoms are also more prominent in LBD, and hallucinations tend to appear much earlier. Understanding these differences is important, because treatment approaches can vary. Treatment, medical approach. Is there a cure right now? No, but that doesn't mean there's nothing that can be done. There are treatments that can help manage symptoms, improve quality of life, and make daily functioning more stable. Doctors often start with cholinesterase inhibitors, the same class of medications used in Alzheimer's disease. These drugs work by increasing levels of acetylcholine, a chemical in the brain that supports memory, attention, and communication. In people with Lewy body dementia, they can do more than just improve thinking. They may also help reduce hallucinations and improve overall alertness. For movement-related symptoms, like stiffness, slowed movement, or tremors, medications commonly used in Parkinson's disease may be introduced. But this is where treatment becomes delicate, because while these medications can improve mobility, they can sometimes make hallucinations or confusion worse. So doctors have to carefully balance the benefits and risks. And then there's one of the most critical points in managing LBD: medication sensitivity. People with Lewy body dementia can react very strongly to certain drugs, especially antipsychotics. Medications that are commonly used in other conditions can cause severe side effects here, including extreme confusion, heavy sedation, worsening movement problems, and in some cases, serious or even life-threatening reactions. That's why treatment for LBD isn't just about prescribing medication. It's about choosing the right medication at the right dose with the right timing, and most importantly, under the care of someone who truly understands the condition. Because in Lewy body dementia, the wrong treatment can sometimes do more harm than good, but the right approach can make a meaningful difference in how someone experiences their day-to-day life. Non-medical support. Just like other dementias, non-medical approaches are essential. Creating a consistent routine helps reduce confusion. A calm, structured environment can minimize hallucinations and anxiety. Good sleep hygiene is important, especially because sleep disturbances are common. Physical therapy can help with movement and balance. And communication matters. Instead of correcting someone experiencing hallucinations, it's often more effective to reassure them and respond calmly. Because from their perspective, what they're experiencing feels real. Causes and risk factors. The exact cause of Lewy body dementia isn't fully understood, but we know it involves the buildup of alpha-synuclein protein. Risk factors include age, most common in people over 50, possible genetic links, overlap with Parkinson's disease, but in many cases, there is no clear single cause. Living with LBD, Lewy body dementia doesn't follow a predictable path. Some days may feel stable, others may feel completely different. This unpredictability can be difficult, not just for the person living with it, but for their family. Hallucinations can be frightening, fluctuations can be confusing, movement issues can limit independence. And because symptoms overlap with other conditions, people often struggle to get the right diagnosis early, which can delay proper care. Caregiving and support. Supporting someone with LBD requires patience and understanding. Key approaches include stay calm during hallucinations, avoid arguing about what is real, maintain a consistent routine, reduce environmental stress, ensure physical safety, and just as important, caregivers need support too, because the emotional toll can be significant. Lewy body dementia is one of the most complex neurological diseases. It blends memory loss, hallucinations, movement problems, and sleep disruption into one condition. But understanding it makes a difference, because early recognition, proper care, and compassionate support can improve quality of life in meaningful ways. If you found this video helpful, share it with someone who needs it. And remember, even when reality becomes unclear, connection still matters.